Good afternoon, ladies and gentlemen. May I call upon my co-panelist, Mr. Veer Raghavan, Mr. Sridhar Mani, Mr. Arvind Kumar, I think somebody else is standing in for him, Mr. Ponraj. Gururaj. And Mr. Selvam. Each one of these people have a very interesting, different perspective of what they are doing. And I will just set the context in about 5 minutes and maybe then leave the floor open to them and come back whenever necessary. You know, I think all of you have been here since morning, and I can see that there have been a galaxy of eminent speakers. There have been, a lot of conversations. As I said, my name is Raghu. I work for Infosys. I'm a senior vice president, and I head the business in India and South Asia. Apart from that, my interest in medicine is possibly that I am a part of INCLIN, which is the International Clinical Epidemiology Network, as a director, and I teach a course called Digital Medicine. Very interestingly, there are a lot of factors that are coming into play, especially when private sector is concerned, the industry is concerned, and the future is concerned. So let me talk about the confluence of forces that is coming to bear. I call it the whole of society approach. And we are doing this interesting research through INCLIN on pentavalent vaccines. And we had this, it is World Bank funded, Bill and Melinda Gates funded. We are trying to track kids who have been given pentavalent vaccine using a lot of digital initiatives. So obviously, if you look at the demographics, we are at a very interesting stage. Kerala has such a different demographic from Uttar Pradesh. Kerala and neighboring Coimbatore, where we are doing some of our field studies, possibly you're looking at the lowest infant mortality ratio. Whereas up there in UP and Bihar, where elections are going on, you're talking about something different. Then on the other hand, if you look at the economics of it, there is only a certain sum of money which we collect from the taxpayers, and beyond that, it's going to become, the law of economics are going to kick in, and you're not going to get anything. But then there are too many claimants for that particular taxpayers' money. With everybody having social activism from MNREGA to what have you, if you look at the budget and if you draw a line on the percentage actually allotted to healthcare year over year, it is actually coming down. Okay, so that's your second problem. The third problem, despite the fact that it is coming down, who is going to pay for the healthcare? Now, that's $1 million question, because, while I'm a, socialist at heart, and I run an NGO, I run a couple of NGOs, etc., because I've been blessed. But then, if you look at the entire ecosystem, the government has been withdrawing from healthcare to that extent, and how, obviously private sector is about a reasonable amount of profit, whereas there is a social activism there. So how do you reconcile both these two things? The third is scale. I did a back of the envelope calculation. We were sitting with Dr. Ganguly in South Africa. Dr. Ganguly was the ex-chair of ICMR and so on and so forth. So we were saying that if you really want to reach the levels of the United States, you need, tens and thousands of hospitals like Apollo all over the place. That's how much of investment is it going to cost you? We're talking of trillions of dollars. So what's the answer? I told you all the problems. One of the key things that I am very hopeful about is that technology has really gone leaps and bounds. In particular, I'll talk about 4 technologies that are going to change the way healthcare is going to healthcare is going to be looked at. One is your patient health records, electronic health records, PHR, EHR, along with maybe a semantic web attached to it. The second is the entire aspect of wearables. Throw a stone in Bangalore, because I'm involved in incubators. Almost every measurement that has to be taken, there is a wearable, somebody is trying to make a wearable for it. The third is genomics. Genomics has been an on-off science, but with big data, with the amount of computing power that's coming to bear, I think genomics will become a science which will really help us into the future. And the fourth is imaging. I do not know if people have been realizing, but there is a silent revolution out there going on, where what you possibly needed to go to get an imaging done in a clinic is almost becoming handheld. Now, with these, these are the 4 trends, but I'll come back and I'll request my co-panelists to give their views and have a discussion, and we'd like to have more of an interactive discussion with the audience. I'll introduce them to the extent I know, but you can add on whenever you like. Veera Raghavan is, I think you're going first. Veera represents Dell. He's a very senior officer, executive director, and a global practice head for the health services. He has tremendous experience in healthcare, in Wipro, and in the United States. Veera is going to talk about something very important on data and analytics and so on and so forth. And there, I think, for those of you who have a browser ready with you, I'm sure all of you have a browser, you can see, if you want to Google, you can see what Hans Rosling has done. And Hans Rosling really gives some of these very good graphics out there. I was telling Veera as I came in.